Trauma represents damage to the body produced by exchange with environmental energy that is beyond physiologic thresholds and threatens life or function. Swift recognition, coupled with protocolized yet dynamic care, aims to preserve life, limb, and long-term quality of survival. This module reviews primary and secondary trauma assessment principles, recognition and management of tension pneumothorax, hemorrhage control techniques, and traumatic brain injury precautions. After completing this module on trauma, learners will be able to 1. Perform a rapid primary and secondary trauma survey based on Advanced Trauma Life Support (ATLS) standards. 2. Discuss signs of tension pneumothorax and perform needle decompression. 3. Demonstrate proper application of tourniquets, hemostatic gauze, and wound packing. 4. Review strategies for prevention of secondary brain injury in head trauma. The primary survey follows a structured ABCDE approach in order to rapidly identify and manage life-threatening injuries. Key steps. A. Establish a patent airway, including techniques like head tilt chin lift or jaw thrust, inspecting mouth for foreign bodies, and considering cervical spine stabilization. B. Ensure adequate breathing by looking for chest rise, listening for air entry bilaterally, feeling for crepitus, flail segments, and inspecting for penetrating trauma. C. Evaluate circulation by feeling pulse, assessing skin signs, controlling external bleeding sources, and looking for distended neck veins, concerning for pneumothorax. D. Assess neurological disability by noting level of consciousness, AVPU, checking pupils, and blood glucose level. E. Full exposure and environment by cutting clothing to fully inspect body and covering patient. Keep warm to prevent hypothermia. Life threats requiring immediate intervention are managed during primary survey before moving to secondary survey. A more thorough head-to-toe exam assessing all body systems in more depth. Key aspects include inspecting scalp lacerations, hematomas, CSF leaks, checking trachea midline, jugular veins fullness, auscultation, palpation of ribs, breast-chest wall, inspecting wounds, palpating all quadrants of the abdomen, checking pelvis stability, assessing motor function, cap refill, pulses in extremities, and palpating posterior spine processes, spinous midline. Tension pneumothorax should be suspected with hemodynamic compromise and breath sounds absent unilaterally. Requires urgent chest decompression. Needle decompression indications include hemodynamically unstable patients, trauma to chest or abdomen, and unilateral absent breath sounds. The technique involves cleansing site second intercostal space, mid-clavicular above rib, inserting at least 3-inch over the needle catheter, and listening for air release, breath sounds. May require longer catheter finger thoracostomy if tension recurs. Chest tube for hospital. Early control of major bleeding is vital to limit shock, hypothermia, acidosis, and death. Priorities are direct pressure, tourniquet use, then hemostatic gauze packing below the elbow, knee amputations if needed. Tourniquets should be placed 2 to 3 inches proximal to wound, tightened until hemorrhage stops and distal pulse is absent, and clearly marked time applied. Hemostatic gauze, such as combat gauze or Celox gauze, is used with wound packing for hemorrhage control. Works via absorption and coagulation cascade activation and can be removed by surgeons later. Consider for neck, axilla, groin wounds not amenable to tourniquet. Primary injury occurs at the time of head trauma. The goal is to prevent secondary injury by maintaining adequate oxygenation and perfusion to the brain. Interventions include maintaining airway, breathing, ventilation, targeting normal PaO2, PaCO2, incorporating cervical spine protection, elevating head of bed 30 degrees, avoiding hypothermia, and titrating IV fluids to maintain cerebral perfusion pressure. Neurologic decline warrants urgent brain imaging to assess for surgical lesions. The fundamental priority in trauma care is methodical evaluation using standardized surveys to swiftly identify and address life threats, control major bleeding, and prevent subsequent insults like hypoxia and hypotension, which may further compound injuries. Though traumatic injuries often present enormous challenges, advanced first aid providers must remain calm, focused, and work efficiently through protocolized assessments and management plans in order to give casualties the best chance of survival along with preservation of function.